Hello, everyone. Today we're going to be talking about bone health and what you can do about it. So, a quick introduction. My name is Jahan Shiki. I'm a physical therapist and coach, and I specialize in helping adults over 50 get strong and recover so they can stay in the game, whether that's the game like pickleball or the game of life, like keeping up with the grandkids. So, where we're going is we're going to talk about three main topics: bone health, osteopenia and osteoporosis, and then what you can do about managing your bone health and managing some of these issues like osteopenia and osteoporosis. So, why does this matter? Why does bone health matter? Well, it affects a huge number of Americans. About 4% of men and 15.4% of women have osteoporosis. Note that women tend to have it earlier. For example, you'll see similar rates of osteoporosis for women aged 65 compared to men aged 80. Now, all else being equal, we're going to see that trend. Note that osteoporosis increases one's risk of fracture. With fractures, then we see a decreased ability to walk, decreased independence with daily activities, and a risk of premature death. For example, about a third of people who suffer a hip fracture die within a year because of the losses of mobility and other medical complications that occur as a result of that. Now, to have optimal bone health, we have to have this good dance between breaking down and rebuilding the bone. Think of it like a road that's constantly being repaired, rebuilt over time. So, what keeps bones healthy? What keeps that good dance, that good balance of breaking down and rebuilding? Well, there are three main things: good nutrition, healthy lifestyle habits, mostly limiting alcohol and not smoking, as well as load, which I'll talk about next. So, what is load? Load is basically when your bones feel the force of gravity being pushed through them. For example, if you're lying down, your back and your hips aren't having a huge amount of force directly put through them. Whereas when you stand up, if you lift a weight, if you jump, they're going to feel a lot of force being put through them. And that force actually tells the bones to remodel and get stronger. And bones like heavy and fast loads. So activities that are low impact or that are very light actually don't stimulate our bones really well. They like quick, heavy loads. Note that there's this Goldilocks principle where we want not too little load because then our bone health deteriorates, not too much, like where we have a fall and a fracture. We want to find that just right middle spot where we're loading our bones and maintaining their health. So a quick recap, that bone health is this dance, this balance of breaking down and rebuilding. And our bones stay healthy with good nutrition, which I'll talk about later, healthy lifestyle habits like moderate alcohol use and not smoking, as well as load, heavy and fast loads. Of course, abiding by the Goldilocks principle of not too much, not too little, just right. So next, we're going to talk about osteopenia and osteoporosis. So what are these terms? They both refer to when bone breakdown happens faster than the building up of bone. What this leads to is a decrease in bone mineral density, which we'll see in the next slide. So bone is not this solid tissue like we maybe saw in elementary school with some of those skeleton models. Bone actually has a lot of space in it, almost like Swiss cheese. Note that normally we have some space in there. However, with osteoporosis, we've had too much of that breaking down of bone, and now there's too much space within the bone. It's not quite as strong as we would like it to be. So these two terms, osteopenia and osteoporosis, both refer to lower bone density. Osteopenia is a less severe version of this, and osteoporosis is a more severe version. They both increase the risk of fracture, but osteoporosis is a much more severe version of bone mineral loss. So how do we measure these things? How do we classify osteopenia and osteoporosis? Well, we use a DEXA scan, and this machine will measure your bone mineral density at your low back, your wrist, and your hip, because these are common areas of fracture. Note that the bone mineral density can be different at these different areas. So you don't necessarily have osteoporosis at your low back, wrist, and hip. It could be that one's wrist has osteopenia, one's hip has osteoporosis, and one's low back has actually a normal bone mineral density. Now, that's going to be relevant when we talk about loading of our body and what areas need to have a little bit more load or less load. So what is this bone mineral density score? Well, it's a measure of how far your bone mineral density is from the normal for usually people aged in their 20s. Note that osteopenia is a T-score of -1 to -2.5 below that normal. Osteoporosis, again, is more severe, so it's a T-score of less than -2.5 below the norm for healthy bone. So, quick recap. Osteopenia and osteoporosis are when the breakdown of bone happens faster than the rebuilding of bone, and this leads to a lower bone mineral density. Osteopenia is a less severe version of this, where our T-score, our score with respect to normal healthy bone, is -1 to -2.5 below the norm. Osteoporosis is the more severe version, where that T-score is less than -2.5 below the norm for healthy bone. So what we're going to talk about last is what you can do about your bone health. So there are 5 main steps, which we'll go into detail with. First is talk to your physician. The second relates to nutrition. The third relates to those healthy lifestyle habits, like not smoking and limiting alcohol use. The fourth is exercise. The last is reducing fall risk. So first, talk to your physician. This is going to be crucial, help screen you for various risk factors, such as family history, and even other medical conditions that might be related to poor bone health. Your physician will also possibly order a DEXA scan to get your bone mineral density. They can also help address certain medical conditions that might be affecting your bone health, and they can help prescribe supplements and medications as needed based on your situation. Note that some of the medications are for stopping the breakdown of bone, and some are for promoting the rebuilding of bone, but that will depend on your specific situation and what your needs are. The next step is what you can do as far as nutrition. So while supplements can be a great addition to a diet, we also want to choose whole foods to get some of these key nutrients that are good for bone, especially vitamin D and calcium. So you can find vitamin D in leafy greens, broccoli, legumes, figs. There's a lot of foods that have this. And in addition to just getting vitamin D, you're also getting a huge number of other nutrients that are healthy for your body overall. For calcium, we have dairy products like milk, cheese, yogurt, but there are also a lot of lactose-free versions if you have a sensitivity there. The next piece of nutrition is to just generally have a rich, varied, mostly whole food diet. I think of it like getting the rainbow of nutrients. This is helpful for bone health, but is also helpful to our body overall. The third step is to stop smoking and enjoy alcohol, but in moderation. Again, talking to your physician would be helpful because it can be hard to kick some of these habits or to change your use of some of these substances. So I'd recommend talking to them to talk about maybe ways to stop smoking or decrease your alcohol use. Note that high alcohol use with respect to bone health is defined by some organizations as more than 3 standard drinks per day. So it's something you talk to a physician about, your use of alcohol and tobacco. The next piece is exercise. We'll go much more into depth on this one. So remember, load is what our bones like. They like high force, high impact going through them, but it needs to follow the Goldilocks principle. Not too much, not too little, just right. We see in this picture that jump roping for this particular person could be a great exercise to get some good impact through the bones and to stimulate that good remodeling process. So what I'm showing here is a picture of the paper, the Lift More trial. This research study was done down under in Australia, and they had women over 65. Half of them had osteopenia and half of them had osteoporosis. And they mixed them all up into groups where they looked at the effects of two different exercise programs. They looked at high intensity and low intensity exercise. The high intensity exercise group consisted of heavy weightlifting and high impact training, where they were actually grabbing a chin-up bar, then dropping themselves down to get that good impact through their bones when they landed on the ground. The low intensity exercise group was recommended to walk, perform very light exercises, and stretch. In this study, they then tracked their bone mineral density over 8 months, and they wanted to see what would be the difference between these two groups. So what they saw was that the high intensity exercise group actually increased their bone mineral density. In the back, they increased it by 3%. In the hip, they increased it by 0.3%. On the other hand, the low intensity exercise group actually lost bone mineral density. In the back, they lost about 1.2%. In the hip, they lost about 1.9%. And there were no injuries reported in either group. So what this means is that high intensity exercise is actually safe and really good for bone health. We actually saw an increase in bone mineral density with people with osteopenia and osteoporosis. On the other hand, this shows pretty well that low intensity exercise is not protective for bone health. Note that it is still healthy in many other ways. So I don't want people to think that low intensity exercise is not good for them. It's just that it's not enough for good bone health. So going back to exercise, what I want to talk about are that we need to load those areas we want to improve, namely our hip, back, and wrist. So we want to choose exercises that actually load those areas. So a common question I'll get is it safe to do this if I have joint pain, if I have osteoarthritis? Yes, it actually is. Exercise is the first line treatment for arthritis and many other joint problems. Of course, we want to start slow and gradually increase, but in no way is exercise contraindicated or is it dangerous for people who have osteoarthritis or joint pain. In fact, it's often a great thing for them and actually can help with a lot of those issues. So another question I'll get is, what about swimming or biking or walking? Like I said, these lower impact activities are great for heart health. They're good for blood sugar. They're good for so many other things in our body. However, they don't stimulate our bones. Our bones need relatively high and fast loads to stay healthy. Note that high and fast loads are going to be relative to each person. So I really want to emphasize again that swimming and biking are great. I recommend everyone find some good aerobic activity to do like that. But our bones need a different kind of stimulus. They need something else to stay healthy. So the question is then, what kinds of exercise specifically? Well, I'm going to talk about three main things: high load strength training, impact training, and balance training. So strength training is lifting a weight, lifting your body. Impact training is things like jumping or heel drops, where you're going up onto your toes, dropping down quickly onto your heels. And then there's also balance training. Now, balance training is not to directly change bone health, but it is to reduce fall risk. I'd first recommend talking to a physical therapist like myself or another. Now, you can do direct access, which means you can go directly to a physical therapist, or you can get a referral through a physician. This is typically covered by insurance. And the reason I'd recommend this is that based on your bone mineral density, your specific situation, other medical conditions, it's best to get a customized program so you can really be progressed in the best way for you. What I'd recommend after getting your sort of custom program is to then work in community programs, like some of the great senior fitness and balance classes, dance classes, Tai Chi. Note that dance and Tai Chi are more for the balance piece, whereas some of those fitness classes are going to be more for loading the bones, getting that good load through them. So that wraps up exercise. The last piece is going to be reducing fall risk. So a huge part of that is going to be exercise, like we just talked about, but also assessing vision and footwear, addressing other factors like medical conditions that might impact your balance, orthostatic hypotension, which is a decrease in blood pressure when you go from lying down to standing up or sitting, standing up, and also the fear of falling, because that itself is a risk factor for falling. There's also checking your home and keeping it free of hazards and optimizing it to reduce your risk of falling. So some quick resources for that. Again, today I'm focusing on osteoporosis and osteopenia, but some things you can look at are STEADY, which is a CDC initiative to reduce fall risk in the older adult, and also reaching out to me. I would love to talk with you more and talk about ways to reduce your fall risk and get you involved in some kind of program to get you on the right path with that. So quick recap. These are the 5 steps that you can take to take control of your bone health. The first is talk to your physician. That is the #1 step. That is the first thing I'm doing. The next is nutrition. So choosing those foods that are high in vitamin D and calcium. The third is to stop smoking and limit alcohol use. Again, that's probably the best conversation to have with your physician. The fourth is exercise. For that, I'd recommend talking to a physical therapist. 5 is reducing fall risk, checking out the STEADY recommendations from the CDC, reaching out to myself or other physical therapists for consultation with respect to that. So here are a couple of the research studies that I referenced. And thank you for your time. If you have any questions, you can email me, find me on my website or Facebook, and I would love to chat with you more and talk about osteoporosis, balance, and all things related to that.